and welcome to our monthly education group for the Caregiver Support Program at the Sioux Falls VA. Today we have Molly Urias. She's been a registered dietitian for almost 7 years and with the VA for almost 2. She has experience working in both the inpatient and outpatient settings. In this presentation, we're going to be learning about general healthy nutrition, weight loss, weight gain, um, nutrition support, specifically about tube feedings. We'll also talk about all the different nutrition resources the VA has to offer, um, caregivers and veterans. So, Molly, go ahead and take it away.
Thank you. Perfect. So, topic for today is just nutrition for the veteran. So, our agenda overall is going to be, like Erica mentioned, general healthy nutrition, weight loss, enteral nutrition or tube feedings, and then some VA resources that we have. So, we'll start with general healthy nutrition. As far as diet goes, My Plate is a nice visual to simplify eating. My Plate took place of the food pyramid. The USD came out with it back in June of 2011. So about 14 years ago, we switched from My Pyramid to My Plate. It's more user-friendly. It's more relevant to our dietary guidelines. During this time of year, it's even more important to eat a balanced diet. As we go through each food section here, you'll see that each nutrient and food group supplies and benefits provide, especially to our immune health. So we'll start off here with fruits. Our daily goal for fruits is 2 to 2.5 cups daily. Fruits are considered low in fat, low in sodium or salt, low in calories, and they don't contain cholesterol. Some of the nutrients they provide is fiber, which is good for our gut, helps with regular bowel movements, weight maintenance, and can help reduce the risk of heart disease. Also provides potassium, which is good for our brain function, can help stabilize blood pressure, and can help with muscle strength and even help prevent muscle cramping. Vitamin C is good for our immune support, our skin, our heart, eye health, and can also help with iron absorption. Fruits also provide folate, which can help prevent anemia, help with blood cell formation, and can reduce stroke risks. Overall, fruits can help lower our caloric intake since they are low in calories, can help reduce the risk of heart disease, and can also protect against certain types of cancer. Next, we'll move on to vegetables. Our daily goal for vegetables is 3 to 4 cups a day. They're considered low in fat and also low in calories. One thing I'll mention as we look at the plate, half of our plate is fruits and vegetables, and a big thing to point out is the vegetable section is bigger than the fruit section. Some of the nutrients that vegetables provide, potassium, fiber, folate, which we talked about those, and then vitamin A, which can help support our vision, boost our immune function, and can also help with skin and bone health. Overall, vegetables again can help lower caloric intake given that they are low in calories, can help reduce the risk for heart disease, and can also, just like fruits, help protect against certain types of cancer. Next, we'll move into whole grains. So we have half of our plate fruits and vegetables being bigger than fruit. The other half of our plate we want to be whole grains and protein. Whole grains being a little bit bigger than that protein portion. For our whole grains, our daily goal is 3.5 to 5 equivalents. So what is an equivalent? One equivalent is like a slice of bread, but we also want to look at that nutrition facts label, and we want it to have at least 2 grams of fiber or more for that slice of bread. Half a cup of oatmeal is an equivalent. Rice, that should say, sorry about that. Couscous, barley, whole wheat pasta, quinoa, 3 cups of popcorn would be an equivalent, half an English muffin, or 5 to 7 crackers. Again, we want those crackers to have at least 2 grams of fiber in them. Some of the nutrients that whole grains provide, they're a carbohydrate, so a good fuel source. They also contain fiber, just like our fruits and vegetables. They contain B vitamins, which are good for our heart health, can help with anemia. They also help with immune support. Um, we found that low levels or deficiencies in specifically B3 and B12 can be linked to dementia, so making sure we're staying up with our vitamins. They also have good sources of minerals such as iron, which is good for our brain health, also can help with anemia, immune support, sleep, and energy. Magnesium, which is good for blood pressure, bone health. It's good for our mood and our mental health, especially, in these dark winter months, can help with that. And magnesium can also help promote better sleep. Selenium is also provided by whole grains, which is good for our immune health, can support thyroid function, and can also help reduce inflammation. Some of the overall benefits of whole grains is it can reduce risk of heart disease, it helps support healthy digestion, and can help with weight management. So the other portion under our grains is our protein, so the other half of that plate. And our goal overall is 5 to 7 ounce equivalents daily. Most of us are probably getting more than this, which is okay. One equivalent is like an ounce of meat, one egg, a tablespoon of a nut butter, peanut butter, almond butter, or a fourth cup of cooked beans and lentils. So some of the nutrients that proteins provide is overall protein, which we know can help reduce cravings, make us feel full for longer. Muscle growth, it can help boost metabolism, help strengthen our immune system, and promote healthy skin. B vitamins, vitamin E, which can improve liver health, improve heart disease risk factors, and can reduce inflammation. Iron, zinc, which is good again for our immune health. If we have any wounds that need to be healed, zinc is good for that as well, and also hormone production. Another nutrient of protein is magnesium, which we talked about. Overall, protein, building block for our bones, muscle, cartilage, skin, and blood. It's also a building block for enzymes, hormones, and vitamins in our body that we need. Eating 8 ounces of seafood weekly can help reduce risk for heart disease, which we'll touch on fish and fats here in a little bit. So then off to the side of my plate. So we've got half of our plate fruits and vegetables, the other half whole grains and protein, and then we need to include some sort of dairy into our diet as well. And our goal would be 3 cups a day. So dairy can be either like our milk, our cheese, our yogurt, all those good things. Some of the nutrients that dairy provides is calcium, which is good for bone health, muscle and nerve function, and cardiovascular health. Um, phosphorus, which can help support bone growth, aids digestion, can help with energy, protects our joints, and enhances our cognition. And then we have vitamin A, D, B12, riboflavin, which can help boost energy, supports growth, and helps with our skin as well. Dairy also has protein in it, potassium, zinc, magnesium, selenium, and choline. And choline helps support liver function, brain health. It aids in our metabolism, which is important, and can help support muscle function. So overall, our benefits of dairy is it improves and promotes bone health, prevents the start of osteoporosis in adults, and low fat and fat-free dairy products are low in saturated fat, which we will talk about next. So we'll move on to fats, which we know is not part of our My Plate, but it is a big part of our diet. So we look at LDL and it says equals bad cholesterol. Well, LDL stands for low density lipoproteins. This type of cholesterol can collect in the walls of our blood vessels, which can increase our chances of health problems such as heart disease, heart attack, or stroke. Other factors for LDL cholesterol include our genes, our age, whether we're male or female, medications, lack of exercise, being overweight, but also foods affect our LDL cholesterol. So the foods that we want to limit are saturated fats, which can be found in meats such as red meats, pork, beef, those types of things, processed meats, full fat dairy. And then on top of those, we also want to try to avoid and limit things like fried foods, fast foods, and some of those baked goods, as we can find some trans fats in those, which all attribute to our LDL cholesterol. But then we also want to talk about healthy fats because we do need fat in our diet. Not saying we can't have any fat, but we need some healthier fats. So healthier fats or monounsaturated fats can come from fish, plants, and liquid vegetables. And they can help reduce that LDL or our bad cholesterol levels while increasing our HDL or high density lipoproteins, which is our good cholesterol. So we want those healthier fats to help reduce our bad cholesterol, which then in fact can help reduce heart disease and stroke. So this is a great resource, myplate.gov. If we can go to this website, we'll see if it will lead us there. I'll pull it over here. So on this website, there's all kinds of different things that you can look at. It's a great resource. You can go to each specific part of my plate that we talked about. Lots of different resources. Again, it can give you, if you don't remember how much we need, we can look it up here. The nutrients it provides, tips to get in extra vegetables into our meals or fruits. There's also, you can go by our life stage. So, excuse me, we'll look up older adult. It'll give you specific recommendations based on where we are at in our life. So a great resource to check out and find other information on. So now that we kind of talked about just like a general healthy diet, we'll kind of move into weight loss. It's kind of a broad topic that we could probably spend our entire time talking about, but we're just going to go over some general guidelines to help with weight loss. So just some tips for success. We want to make changes that are obtainable, such as starting with a simple goal of, I want to increase my water intake to 8 cups a day. Simple change that we want to do. Once we've met that, maybe it takes a week or two, then maybe we start another goal, such as I'm going to walk 20 minutes a day for 4 days during the week. And once we meet that, we can add another goal. So making those lifestyle changes maintainable. We don't want to do too much at one time. Eating wisely and cutting out extra calories. So a 3,500 calorie deficit in general will result in a 1 pound weight loss. So what that looks like is if we were to cut out an extra 500 calories a day, so if we were eating, let's say 2,500 calories a day, and we went down to 2,000 calories a day, over the span of 1 week or 7 days, it would result in a 1 pound weight loss that week, which is very obtainable and gradual, which is what we want for long-term success. Another tip would be trying to be physically active. It not only helps with weight loss, but it can also help with your sleep, your mental health, your blood pressure, and your risk for diabetes. In the Midwest, sometimes being physically active in the winter can be hard. So going to even like a mall or a large, store and just walking around the edges, you can get a lot of extra steps in that way too. You don't necessarily need to go out and get like a gym membership for that. Um, don't be afraid to ask for help or support. You have family, friends, and also all of us here at the VA are here to help with your journey. And then celebrate your successes. Don't forget to do that. It's, accomplishing some of these goals is a huge thing to celebrate and be proud of yourself for. when we talk about weight loss, another thing that comes to mind is probably some of these medications that are out. So here at the VA, not everyone is eligible or appropriate for weight loss medications. So if you are eligible, some of the criteria that they look at is your BMI and then some weight related conditions you may have. So hypertension, diabetes type 2, hyperlipidemia, or like sleep apnea. Um, Another thing here at the VA is to get some of these medications, you also have to be a part of the MOVE program, um, which we will talk about here in a little bit. These medications also aren't the easy way out either. There are many side effects to these, such as constipation, diarrhea, GI upset, including nausea, vomiting, and can also affect, sleep disturbances. So most effective way as in these medications work is also lifestyle changes. So it brings us back to the beginning, making simple lifestyle changes that are obtainable and maintainable. So when talking about weight loss, eating out is a big part of a lot of our daily socialization and everything. So we don't want to say you can't eat out anymore, but maybe there are some things that we can change when we eat out that can help with some of our goals in weight loss. So when we're looking at our main entree options when we go out to eat, trying to still follow my plate as well to help decrease calories, increase fiber and other vitamins and minerals, trying to look for something like a salad, choosing grilled meats over fried meats, looking for an option such as fish. Obviously, we don't want to do like the fried fish, but something that is like baked or grilled. Um, Other big changes we can make are in our sides. So instead of like our French fries or our cheese curds or our onion rings, we could choose something like a side salad, a fresh bowl of fruit. Cottage cheese is a one that I see a lot when going out to dinner as a side option. It's high in protein, so that would be a good option. Steam or cooked vegetables, brown rice would be a good whole grain substitute, or even a baked potato, which, some people might say, well, on my baked potato, I put a lot of extra things. So just kind of watching, how much butter or sour cream you put on it. Um, but trying to avoid, on that, as we talk about sour cream and butter, salad dressings, mayo, if we are using some of those condiments, having them on the side, using them just sparingly, don't need a large amount of those. Other tips when eating out would be, splitting your meal into 2 servings before you start eating. So, if you get a large sandwich, asking for a take-home box right away and putting half of your meal in that takeout box so you're not tempted to eat it all in one sitting. And then you also have your meal for, the next meal that you're going to eat. You can also, if you know where you're gonna go out to eat, plan your meal ahead you go. So look at the menu online or, if you get there before, if you're meeting somebody, kind of look at the menu, figure out what would be your best option. Also, don't go where you're starving either. Have maybe a snack before you go out to eat so you don't overeat. Another good change would be choosing water as a beverage versus choosing, like a soda or even like an alcoholic beverage. Easy way to cut out extra calories there. And then trying to skip the appetizer or dessert, or, if you are going out for a special occasion, maybe instead of doing an appetizer, a meal, and a dessert, maybe you just do a meal and you split a dessert. Not having all of those components in every meal can help eliminate some of those extra calories. And then ordering sauces and dressings on the side. Again, this just helps eliminate extra amount of calories, and then you can determine how much of those that you want on your entree. So we briefly talked about Move earlier when we were talking about some of those weight loss medications. So what the Move program is it's a comprehensive weight management program that provides education and support on lifestyle change, including nutrition, physical activity, and behavior changes. The diet, we have a couple dietitians here and also a physical therapist that help instruct during this program. And the MOVE program utilizes an interactive workbook that has 16 modules and chapters that focus on nutrition, physical activity, and those behavior changes. So there's different ways that you can participate in MOVE here at the VA. We have either group classes that are you can do either through video or telehealth, or we also have them in person, and these are weekly 1-hour sessions. The other option would be an individual session, so a one-on-one session that you could either do in person, on the telephone, or again through that video telehealth. And these are typically one time a month and they're for about 30 minutes. So if you're interested in the MOVE program, we do have some online resources and information that I can show you. So this is the Department of Veterans Affairs, the MOVE Weight Management Program webpage here. So lots of different resources here. So if you just have general questions that you're looking for, there's a Q&A portion here. Another really cool one is there's stories, some success stories of veterans who have gone through this program and have done wonderful. So if you're ever curious, lots of good stories there. There's also some of the materials that they use in Move Group or Move Program are on this web page. There's some videos that you can watch that also just have some quick general information as far as behavior and nutrition and physical activity go. So that is another good resource we have here. So we've talked about general healthy nutrition. We've talked about weight loss. Now we're going to get into our enteral nutrition support. So this is another topic we could spend a lot of time on, but we're just going to kind of touch on some basic information about enteral nutrition support or tube feedings. In some of the slides you will see TF, which stands for tube feedings. So a short-term tube feeding would be if we needed it for about 4 weeks or so. And that, if that was the case, we would either have a nasogastric, which is a tube that goes down the nose right here into the stomach. Or the other option is a nasojejunal or NJ tube, which again goes down the nose, past the stomach, and into the small intestine called the jejunum. So that would be short term. If we think we're going to need this enteral nutrition or tube feeding for longer than 4 weeks, greater than 4 to 6 weeks, we will say, then we would be looking at something called a gastrostomy tube or G tube or a percutaneous endoscopic gastrostomy tube or PEG tube. These G tube, gastrostomy tube for short, or PEG tube are the same thing. They both go into the stomach. It's the only difference between these tubes is how they are placed. So both of those tubes go directly into the stomach. And then we have a jejunostomy tube or a J tube, which would go directly in to the jejunum. So the big difference between these long-term versus short-term tubes is these long-term tubes bypass our nose, our esophagus, and they go directly into the stomach, like the G tube or PEG tube, or directly into the jejunum, like our J tube here. So as far as tube feedings go, there are 3 main ways that we would administer nutrition. The most common methods that we use are typically the syringe bolus or our gravity bag. So with a syringe bolus gravity feeding, we have 2 methods. This right here that I am circling would be our push method. So we would just pull up the nutrition or the formula into the syringe and then we would slowly push it in to our feeding tube. The other method, as far as the syringe method, would be gravity method. So we would pour that nutrition into the syringe and hold it up. And with gravity, that would slowly flow into our feeding tube versus it getting pushed in with that bumper or stopper. Gravity bag or drip with gravity, very similar to this syringe gravity, but instead we would have that formula or nutrition in a bag hanging on like an IV pole or at least hanging above the tube. And with the flow of gravity, would slowly flow into that feeding tube. There's on those gravity bags, there's like a little roller clamp that you can adjust up and down that will adjust the flow of how quickly or slowly that nutrition from the bag will flow into the feeding tube. And then the third method would be our pump method, which is where we have a set rate of how much of that nutrition and formula will be going into the feeding tube. We don't use this method as much, but it is an option. As you can see, the pumps sometimes can be a little intimidating. They are pretty user friendly and like I said, it just is a set rate and gives you exactly the amount of nutrition you need per hour based on the recommendations. So with the administration is, okay, what are some of the supplies? So these are just some general supplies that we would use for tube feedings. You know, everyone's supplies are gonna look a little bit differently. They're not all gonna be the same, but you would have like your formula or your nutrition. Then you could have some of those syringes, you know, whether you are doing the syringe method or not. Feeding bags potentially if you are doing like a gravity feeding or a set pump feeding, an IV pole if you are doing the gravity or pump feeding. You could potentially have a feeding pump. And then a big one, if we are administering medications through that feeding tube, a pill crusher is another potential supply that you could have. So obviously with enteral nutrition and tube feedings, there are, you know, some complications that can come up with them and just some general ones. Uh, Nausea. So if we're having nausea, you know, what can we do to try to help with that? One big thing is we could try to slow those feedings down. You know, if we're doing that push syringe method, if we're feeling nauseous with it, maybe we try the gravity and we pull that plunger out of the syringe and just let it drip in a little bit slower. Um, if we're having vomiting, a big thing would be, you know, let's stop those feedings, maybe contact our provider, contact our dietitian. A lot of times we might need to, you know, restart those feedings a little bit slower. We might need to look into if we're having other GI issues as well. Diarrhea and constipation. So with diarrhea, sometimes we need to slow the feedings down. Maybe we're administering them too fast, so they're flowing through our GI system a little bit too quickly. We potentially might need to add fiber into our feedings, you know, and I wouldn't recommend just doing that on your own. Again, we would have to talk with provider, dietitian on recommendations of what we need to do for that. But on the other side of diarrhea, we have constipation, you know, so if we're having constipation with our tube feedings, that's not comfortable either. So a lot of times with constipation, we maybe need to increase some of our water flushes. Maybe we're not getting enough fluid into with our feedings. Some other complications, abdominal distension, bloating, cramping, you know, any of those uncomfortable GI symptoms. Different things that we might need to do would be adjust our tube feeding rate again. Maybe we need to slow them down a little bit. Maybe we need to adjust our water flushes because maybe we're constipated and that's causing bloating. Maybe we need to look at the fiber content of our enteral nutrition that we're getting. Maybe we need to switch that up a little bit. So a lot of different things. And, you know, the nausea, vomiting, constipation, diarrhea, abdominal distension, bloating, all those things can kind of play together. So we also got to look at the whole picture as well with that. Um, Aspiration or, you know, having that formula go into the wrong place, that is a big complication that we want to try to avoid. So to avoid that, we always need to make sure when we are doing any sort of tube feeding or enteral nutrition that the head of the bed is at least 30 to 45 degrees or higher. So either we need to be propped up or we need to be sitting up. Um, I've had patients before walk around, if they have like a gravity bag with an IV pull, they can kind of walk around with their feedings. They can find that they sometimes tolerate feedings better that way too. Another complication we potentially could see is if that tube gets clogged. So if you're trying to, administer your feedings or your medications and that tube is just not budging. Some different things you could try at home would be flushing that tube with warm water. If that's not working, you could use warm water, and then if you take that syringe and use the plunger in the syringe and kind of do like a pumping back and forth motion. Sometimes with that pressure that can break up what is ever in that tube. If that's still not working, you can contact your provider, your dietitian, or even pharmacist, and we can get a prescription for some enzymes that we can put through that tube that can kind of break up whatever is in there and causing it to be clogged. Um, Last complication, not necessarily the only complication left, but a big one would be if that tube um, gets malpositioned. So whether that tube is in the nose or the stomach, but we notice that it's been moved or it's been pulled out, the biggest thing with that is do not put anything down that tube. Stop the feedings if they are going and seek help from the provider, as we do not want to feed into the wrong area of our body. And the biggest solution with that would be, like I mentioned, contact the provider. Most likely they're going to want to do some sort of like x-ray or scan to check to make sure that tube is not in the wrong place. So overall, to kind of close out the enteral nutrition tube feeding portion, would be do's. The biggest thing is always ask questions. If no question is a dumb question. If you are concerned or worried about something, always ask questions. Follow the instructions from your registered dietitian or your provider. And another big thing is always flush your tube regularly, especially after anything is put into it. So if you're administering medication or um, the enteral nutrition that was prescribed by your dietitian, flush with water after anything is put into that tube. If we put a medication down that tube and then we don't flush it, we have a high risk of having that tube be clogged. So we don't want that. Things we don't want you to do: adjust your feeding regimen without asking your dietitian or provider. Let's say, you're having some nausea or diarrhea and you just decide, oh, I think I'm going to just cut out half my formula. Before you do anything, always ask questions and don't just adjust it on your own. Um, don't adjust water flushes either without talking with your dietitian or provider, as we don't want you to either get too less water or too much water. Just want to make sure you're getting the adequate amount of hydration that you need. And then another big thing we do not want you to do is put any food or purees through your feeding tube. No mashed potatoes, no applesauce, no baby food, nothing like that down your tube. Only the prescription of the enteral nutrition product that was prescribed to you. So that would be a high risk for causing a tube occlusion or clog. So just stick with what is prescribed there. So we've now talked about um, general healthy nutrition in my plate. We've talked about tips for weight loss, including the MOVE program, and we've talked about enteral nutrition or tube feedings. So lastly here, just going to kind of wrap up with some of the resources that are here and available to you at the VA as far as nutrition goes. So some of the outpatient resources we have available is the MOVE group or MOVE program, which we talked about. We have a diabetes group. We have a chronic kidney disease or CKD class. And then we also have our registered dietitians and counseling that we can provide. So we'll break each of these down and kind of talk about them. So the Healthier Kidneys Through Your Kitchen is a prevention program for chronic kidney disease or CKD. This group or class meets on the second Wednesday of the month from 12 to 1 or 1:30, and that is available via telehealth. Another group that we have available is our diabetes group education, which is a comprehensive education on how to successfully live a healthy life with diabetes diagnosis. Some of the topics that this group covers is diabetes basics, healthy eating, physical activity, monitoring blood sugars, acute complications that can happen from diabetes, medications in diabetes, A1C results and targets, reducing risk of chronic complications, heart healthy eating, healthy coping, diabetes distress, and problem solving. This group is available on the second Thursday of the month from 9:30 to 11 via VVC, or there's a group that meets face to face in Sioux Falls on the third Wednesday of the month from 1 to 3. So if you're just looking for general nutrition guidance and help, we have a lot of resources that we can offer as outpatient dietitian counseling. We use evidence-based nutrition therapy while providing, excuse me, one-on-one counseling. We can personalize recommendations for you, including specific nutrition recommendations based on if you have a chronic disease. We can help with meal planning, label reading, and even just like quick tips and tricks. There's no referral needed to see an outpatient dietitian. You can either give that number on there a call with extension 6359, or you can secure message the nutrition team to set up an appointment as well. With that, the last resource I'll share with you is the Department of Veterans Affairs Nutrition and Food Service page. This page has a lot of really good resources as well, including nutrition for specific diseases. There's a nutrition blog that you can go to. There's videos on this healthy teaching kitchen with handouts and videos to show you, just ways on how to cook. There's also recipes too. So if you're looking for, new ideas to incorporate, now that we've talked about my plate and you want to try to maybe incorporate some more fruits and vegetables into your meals or transition to whole grains, a lot of good recipes on here that you can incorporate. Um, there's also some videos on like diabetes and management, and then another big one would be food security. So if you do have concerns with having some food insecurity, there are resources on this page to help. Also know that we have resources here at the VA as well in Sioux Falls that we can help you with. So there are tons of resources out there as far as nutrition goes, whether it's classes you can go to, online resources, or we have one-on-one. And we're always, always welcome to come in and see us and would love to help you out with any nutrition questions or concerns that you may have. And thank you for your time. And that is my contact information. If you have any questions or want to, you feel free to reach out to me. Thank you.
Molly, can I ask a quick question?
Yes, yeah,
Um, so for the groups and whatnot you talked about, are
yeah.
those specifically for veterans, or do they ever bring like family members with them?
You are more than welcome to bring a family member with you to, whether you go to the chronic kidney disease class, the diabetes class, the MOVE program, or even just like a one-on-one counseling session with a dietitian. You're welcome to either go on your own, or you can also bring your caregiver or family with you as well.